Now we're going to start the blood supply of the heart. So blood supply means artery supply and the venous drainage. So first we discuss the artery supply. So heart is supplied by coronary arteries. Now the coronary arteries origin from aortic sinus. See, at the beginning of aorta, we have some space, and that space is called aortic sinus. Now, if you take the cut section of the aortic sinus you can divide into two: anterior aortic sinus, and this is posterior aortic sinus. So now, aortic sinus, we have taken a section. Okay, we have anterior aortic sinus and posterior aortic sinus. Now, anterior aortic sinus will give origin to right coronary artery. So, right coronary artery origin from anterior aortic sinus. Very good. Now, what about the left coronary artery? Now, left coronary artery is coming from, this is left posterior aortic sinus, and this is right posterior aortic sinus. I told you the left coronary artery is taking origin from left posterior aortic sinus. Left coronary artery is taking origin from left posterior aortic sinus. We have only two coronary artery, right and left. Right coronary artery origin from anterior aortic sinus. Left coronary artery origin from left posterior aortic sinus. Now we have one more aortic sinus, that is right posterior aortic sinus. Now right posterior aortic sinus, it is not giving any origin to any coronary artery. So coronary arteries, no coronary artery is taking origin from right posterior aortic sinus. So right posterior aortic sinus is called non-coronary sinus. It is called non-coronary sinus because coronary arteries, they are not taking origin from right posterior aortic sinus. Clear? Right. This is the origin of the coronary arteries. Now see the diagram. Now in the diagram, first artery we're going to discuss right coronary artery. Now right coronary artery, first we discuss the course. See, course, we are not getting any question from the course of the artery. For the completion's sake, we see. Again, if you have a basic idea about the course of the artery, that is more than sufficient. Now after the origin, the right coronary artery, which is descending between, this is right atrium and this is right ventricle. I told you between the atrium and ventricle we have a groove, atrioventricular groove, atrioventricular sulcus, coronary sulcus. Very good. Now right coronary artery, which is passing in anterior part of right atrioventricular groove, anterior part of right atrioventricular groove, or anterior part of right coronary sulcus. Okay, right. Next. Now after passing in the right anterior coronary sulcus, now the right coronary artery, it is winding around the inferior border of the heart. This is the inferior border of the heart. So right coronary artery, which wind the inferior border of the heart. Now after winding around the inferior border, now see the right coronary artery. The right coronary artery, again it is passing between the atrium and ventricle on the back side. So artery is passing in the posterior part of right atrioventricular groove or posterior part of right coronary sulcus, and which reach the crux of the heart. And after reaching the crux of the heart, the artery is anastomosing with circumflex artery. Artery is anastomosing with circumflex artery. Circumflex artery is a branch of left coronary artery. Okay. Yes, this is the right coronary artery passing in posterior part of atrioventricular groove, which in turn anastomose between the circumflex artery. Okay, right. That's all about the course. Next, branches of the right coronary artery. That is very important. Now, what are the branches? Now, branches. Now, this is the first branch, number 1. Now, the first branch is the right conus artery. Right conus artery. Now, right conus artery, which supply the conus part of right ventricle. So, conus part means the outflow part of right ventricle or infundibular part of right ventricle. Now, right conus artery sometimes, very rarely, it may arise from aortic sinus. Now, if it is arising from aortic sinus, then this artery is called third coronary artery. Third coronary artery. I told you just now. Aortic sinus is giving origin to coronary arteries. Now, if right conus artery is arising from aortic sinus, then the right conus artery, also called as third coronary artery, because it is origin from aortic sinus. But it is not a usual one. Very rarely you may see this. Right. Now, this right conus artery, which in turn anastomoses with left conus artery. Now, this is our left coronary artery, is giving the anterior interventricular artery. Okay. And this is the circumflex artery. Now, this anterior interventricular artery is giving left conus artery. Okay. So, now we have left conus artery arising from anterior interventricular artery. Now, right conus artery and left conus artery anastomose with each other. Right conus artery anastomose with left conus artery. Left conus artery. Now, and they form one pattern, and that is called annulus of Vuissens. That is called annulus of Vuissens. So, annulus of Vuissens is nothing but it is anastomose of right conus artery and the left conus artery. Clear? So, first branch over. Next, the second branch. This is our SA nodal artery. Okay, so SA nodal artery is coming from right coronary artery. It is coming from right coronary artery. Again, 65% of cases, it is coming from right coronary artery. SA nodal artery coming from right coronary artery in 65% of cases. In 35% of cases, the SA nodal artery is coming from circumflex artery. It is coming from circumflex artery. Okay, right. Now next, now see these branches. I'm putting a bracket, a common bracket for all this. Now these branches are called, this number 3, I will mark as number 3. Number 3 is, now that is right anterior ventricular rami. Right anterior ventricular rami. Now right anterior ventricular rami, it supply anterior part of right ventricle. Again, we have many branches. Rami, plural form. Ramus, singular form. So, right anterior ventricular rami, we have numerous branches coming from the right coronary artery. They supply the anterior surface of right ventricle. Now, here, now see this branch. Now, this branch is a very large branch of right anterior ventricular rami, and that branch is called right marginal artery. So, right marginal artery is the large branch of right anterior ventricular rami. Now, the angle of origin of right marginal artery is acute. So, this artery is also called as acute marginal artery. Now, in the exam, they will ask you this. See, right marginal artery, the name itself you have a clue. It is coming from right coronary artery. Definitely, you won't get this question. The question is, the other name of right marginal artery is acute marginal artery. Now, why it is called acute marginal artery? The angle of origin of the right marginal artery is acute to the trunk of right coronary artery. That is why it is called acute marginal artery. So, acute marginal artery, the angle of origin of this artery is acute to the trunk of right coronary artery. Okay. So, that is why this artery is called acute marginal artery. Right. Now, this acute marginal artery, after the origin, which reach up to the apex of the heart. I told you already, apex of the heart is formed by left ventricle. Yes. And it supplies the adjoining areas. That's all about right anterior ventricular rami. Now, one last branch of right coronary. Now, see the diagram. Now, I'm talking about this artery. Now, this artery is descending in the posterior interventricular groove. The artery is called posterior interventricular artery or posterior descending artery. Both are same. Posterior interventricular artery or posterior descending artery. So please write posterior interventricular artery. Interventricular artery. So it descend in the posterior interventricular groove and which supply the diaphragmatic surface of right ventricle and left ventricle. Now this posterior interventricular artery also gives septal branch. The septal branch supplies the posterior 1/3 of interventricular septum. Posterior 1/3 of interventricular septum. Okay. And the septal branch also supplies AV node. The septal branch also supply AV node. This is very important. Okay. Right. So these are all the branches of our right coronary artery, and that's all about the right coronary artery. Okay. Now next we're going to see left coronary artery. Left coronary artery, we know the origin. It is coming from left posterior aortic sinus. Very good. Now after the origin, the left coronary artery divided into left circumflex artery and left anterior descending artery, which is also known as left anterior interventricular artery. Anterior interventricular artery. Okay. Now we're going to see first left anterior interventricular artery. Again, name itself we have a clue. The artery is passing in the anterior part of interventricular sulcus, anterior part of interventricular groove, and which supply the anterior surface or sternocostal surface of right ventricle and left ventricle. Okay, right. And the left anterior interventricular artery also gives septal branch. Left anterior interventricular artery also gives septal branch. The septal branch supplies anterior 2/3 of interventricular septum. So interventricular septum supplied by anterior and posterior interventricular artery. Posterior interventricular artery supplies posterior 1/3 of interventricular septum. Anterior interventricular artery supplies anterior 2/3 of interventricular septum. Okay, right. Number 3. Now the anterior interventricular artery also gives a diagonal artery, which also gives diagonal artery. Now diagonal artery supplies, this is very important. In 2019 AIIMS exam, we got this question. Diagonal artery supplies only anterior surface of left ventricle. This is very important. I told you 2019 AIIMS exam, we got this question. Diagonal artery supplies anterior surface of left ventricle. Okay. Now anterior interventricular artery, which wind around the inferior border and anastomose with posterior interventricular artery. Now anterior interventricular artery, which wind around the inferior border, and anastomose with posterior interventricular artery. Okay, that's all about anterior interventricular artery. Next one, circumflex artery. Now circumflex artery, it is very simple. Again, course is not that much important. So now the circumflex artery, which begins at the left atrioventricular sulcus, Now see circumflex artery. The circumflex artery after the origin, which wind around the left border. Okay. After winding around the left border, the artery is passing in left posterior coronary sulcus, left posterior atrioventricular sulcus, and reaching the crux and anastomose with the right coronary artery. Okay. Now what are the branches coming from the circumflex artery? Number 1, the circumflex artery branches. It give a branch to left atrium and left ventricle. So circumflex artery giving a branch to left atrium and left ventricle. Fine. And the circumflex artery also gives the left marginal artery. Now left marginal artery, which descend along the left border of the heart and then reach the apex of the heart. Now, left marginal artery is a branch of circumflex artery. Again, very simple. Definitely, they won't give this question. We have other name for left marginal artery. That is a question. Now, left marginal artery, also known as obtuse marginal artery. Also known as obtuse marginal artery. So, why obtuse marginal artery? The angle of origin of left marginal artery from the circumflex is obtuse, more than 90 degree. So, obtuse marginal artery, also known as left marginal artery, the angle of origin is more than 90 degree from the circumflex artery. So, again, this is the question. Obtuse marginal artery is a branch of circumflex artery. I told you already, SA nodal artery. Now, SA nodal artery, in 35% of the cases, it is coming from circumflex. And one last branch, again, it's not a normal branch. Very rarely, the posterior interventricular artery, very rarely, posterior interventricular artery, it may arise from circumflex. Arise from circumflex artery. Very rarely, posterior interventricular artery arising from circumflex. If the posterior interventricular artery arising from circumflex artery, then the entire ventricle, see, ventricle is supplied by anterior interventricular artery and posterior interventricular artery. Similarly, interventricular septum supplied by anterior and posterior interventricular artery. Now, in this case, anterior interventricular artery is a branch of left coronary artery. Posterior interventricular artery is a branch of, in this case, I am saying, it's coming from circumflex artery. Circumflex artery is a branch of left coronary artery. So, in this case, if posterior interventricular artery is coming from circumflex, the entire ventricle, the entire interventricular septum, it is supplied by left coronary artery. Now, which artery is dominant? Left coronary artery is dominant. Now, this condition is called left coronary dominance. Left coronary dominance. Now, when you say left coronary dominance, if the posterior interventricular artery arising from circumflex artery, then the condition is called left coronary dominance. Again, left coronary dominance is having very bad prognosis. Why, sir? Because the entire burden to supply the ventricles and the interventricular septum, it is on left coronary artery. So, left coronary artery, it is not able to withstand any small insult. So, that is why the left coronary dominance is having very bad prognosis. Again, I am saying the left coronary dominance is very rare scenario. Most of the individuals, we are having only right coronary dominance. So, what is the meaning for this? The posterior interventricular artery is coming from, yes, very good, right coronary artery. Now, we also have one more type called balanced type. Now, balanced type means the posterior interventricular artery, it is coming from origin from both right coronary artery and circumflex artery. That is called balanced type. Okay, right. So, these are all the branches of the circumflex artery, and by this we are completing the left coronary artery discussion. Clear? Usually the questions from the branches. Now, next we're going to see the blood supply of the conducting system of the heart. So, conducting system of the heart blood supply is very simple. We have SA node and then AV node. From AV node, bundle of His. From here we have right bundle branch and the left bundle branch. Now, SA node and AV node, they are supplied by right coronary artery. The upper part of the conducting system is supplied by right coronary artery. The lower part of the conducting system is supplied by left coronary artery. Is that clear? Now, the branch supplying the AV node, it is also supplying bundle of His. So, I told you the AV node is supplied by right coronary artery. The branch of right coronary artery, that is our posterior interventricular artery, the septal branch supplies the AV node. I hope you remember. That branch also supplies bundle of His. Okay. Now, the right coronary artery also gives a contribution to left bundle branch. Okay. So, right coronary artery supplies SA node, AV node, bundle of His and left bundle branch. The only part of conducting system which is not supplied by the right coronary artery is right bundle branch. very old NEET question, not in recent exams, very old question. So right bundle branch, it is the only part of conducting system which is not supplied by right coronary artery. Not supplied by right coronary artery. Okay, so right bundle branch not supplied by right coronary artery. That is very important. Okay, right. Now what about the left coronary artery? The left coronary artery supplies bundle of his, right bundle branch and left bundle branch. Bundle of his and the left bundle branch also supplied by right coronary artery. So right bundle branch, it is supplied only by left coronary artery. Okay, right. That's all about the artery supply of the heart. Next, we're going to see the venous drainage. Now the venous blood, the majority of the venous blood from the heart is carried by coronary sinus. Coronary sinus. Okay. So coronary sinus which carry majority of the venous blood from the heart. Okay. Now what is the origin for the coronary sinus? So coronary sinus is arising from the left horn of the sinus venosus. Left horn of the sinus venosus. Okay, so the left horn of sinus venosus regress and form the coronary sinus which carry venous blood from the heart. Right, now the coronary sinus which opens into the posterior smooth part of right atrium. So all the veins, they open into the posterior smooth part of right atrium only. So posterior smooth part of right atrium receives superior vena cava, inferior vena cava and also the coronary sinus. So three veins open into the posterior smooth part of right atrium. Clear? Right. Now what is the course? Again, course is not that much important. So again, have some basic idea about the course of the coronary sinus. That is more than enough. Now the coronary sinus begins at the left anterior atrioventricular sulcus. So it begins at the left anterior atrioventricular sulcus. Atrioventricular sulcus. Now after the origin, which receives great cardiac vein. Which receives great cardiac vein. After receiving the great cardiac vein, the coronary sinus which wind around the left border and which is descending in the left posterior atrioventricular sulcus, and finally which opens into the smooth part of right atrium. Now the opening of the coronary sinus is guarded by one valve. That valve is called Thebesian's valve. So Thebesian's valve is guarding the opening of coronary sinus. This is the course. The question is tributaries of the coronary sinus. All the following are the tributaries of the coronary sinus except. Which are the following are tributary of the coronary sinus? Okay. So, and one more point, the tributaries accompanying structure. That's also a question. So the first point, the tributaries. So tributaries are number one, great cardiac vein. Tributaries are number one, great cardiac vein. The great cardiac vein is a tributary of the coronary sinus. Next point. Now what are the structures? What are the arteries accompanying the great cardiac vein? Now see the diagram. Now this is our left coronary artery, which is dividing into anterior interventricular artery and the circumflex artery. This one. And circumflex artery. This one. Okay. So great cardiac vein, see the diagram. It is accompanying two arteries. What are those? Anterior interventricular artery, number one. And number two, circumflex artery. So please write. So great cardiac vein accompanies two arteries. What are those? Anterior interventricular artery and circumflex artery. And circumflex artery. Okay, sir. Next one. Middle cardiac vein. Now, middle cardiac vein is accompanied by this artery. What artery? Posterior interventricular artery. This is posterior interventricular artery. So second tributary is a middle cardiac vein which accompany posterior interventricular artery. Right. Next tributary, small cardiac vein. Small cardiac vein accompanies the right coronary artery. Right coronary artery will be here. So small cardiac vein accompanies right coronary artery. Okay, right. Now two more veins draining into coronary sinus. What are those? Posterior vein of left ventricle and oblique vein of left atrium. Oblique vein of left atrium. So we're not able to show in the diagram, but please remember these two veins also draining into coronary sinus. Posterior vein of left ventricle and the oblique vein of left atrium. So these are all the tributaries of the coronary sinus. Now an important point is which is not the tributary. Which is not a tributary? Anterior cardiac vein. Anterior cardiac vein, it is not draining into coronary sinus. Anterior cardiac vein which opens directly into the anterior part of right atrium. See, coronary sinus opens into posterior part of right atrium. But anterior cardiac vein, please write, please put one box. Please put one box and then write anterior cardiac vein, very important, which is not the tributary. So anterior cardiac vein, it is not a tributary of the coronary sinus. The anterior cardiac vein opens directly into the anterior part of right atrium. Okay, so these are the points you have to know for the coronary sinus. So coronary sinus, you have to know the origin of the coronary sinus, the termination of the coronary sinus, tributaries, the accompanying arteries of the tributaries, and last point, which is not a tributary, anterior cardiac vein that opens directly into anterior part of right atrium. The posterior part of right atrium receives the coronary sinus. Okay, right. So that's all about the blood supply of the heart.